You've probably heard of Viagra and Cialis for erections, but what if I told you these medications have benefits that go outside the bedroom? I'm talking about things like your heart, your brain, your muscles, and your bladder. I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I'm going to talk about the science of these medications called PDE5 inhibitors and all the things they can do that most people have no idea about. So let's start with the basics. Viagra, Cialis, Levitra, all these medications are called phosphodiesterase type 5 inhibitors or PDE5 inhibitors. So what does that actually mean? Your body produces a chemical called cyclic GMP, cGMP for short, and it causes muscles to relax and blood vessels to dilate, meaning more blood can flow through them. Now, there's an enzyme called PDE5 whose job it is to break down that cGMP. So when you take a PDE5 inhibitor, you're essentially blocking PDE5 so that cGMP can accumulate, meaning that smooth muscle stays relaxed and blood flow stays flowing. And that's why these medications work so well for erectile dysfunction. The penis needs increased blood flow to achieve an erection, and PDE5 inhibitors make blood flow through those vessels flow easily. But PDE5 isn't just in the blood vessels in the penis, it's found all over your body. I even talked about how PDE5 inhibitors were discovered because they were originally studied for high blood pressure. So PDE5 enzymes are found all over your body, in your blood vessels, your lungs, your heart, your brain, your bladder, your prostate, and more. Which means that when you inhibit PDE5, you're potentially affecting all those systems as well. And that's where things get a little bit interesting. Now, before I get into how these medications affect your entire body and all these different systems, I just have to tell you very quickly about my brand new book called The Hard Truth. Guys, this is a book I wish every single man had growing up, every single man has now. It covers what you need to know to not only have a great sex life, but have a great sex life for your entire life. And all the things you're going to learn in this book are going to build a solid foundation for your overall health, for your longevity, and it's going to help you maintain it throughout your entire life. I know pre-ordering is no fun. I don't want to pre-order a book and wait months for it to come out. But the reality is when you pre-order a book, you are basically putting your vote in not only for that author, but for that topic. And that's where this is really important, because when I pitched this book, so many people said men don't buy books. Well, guess what? Men don't buy books because you're not writing books for men. So let's show them that men do buy books and we care about learning and education, and that we want books for our young boys. We want books for ourselves. We want books for our parents. Everyone needs to have these books so they can learn and go back to it when things become difficult. So thank you so much. Check it out at renamalikmd.com/hardtruth. Let's start with your heart and the potential cardiovascular benefits. Sildenafil, or Viagra, is actually FDA approved under the brand name Revatio, specifically for a condition called pulmonary arterial hypertension. That's high blood pressure in the arteries of the lungs, which makes the right side of the heart work really, really hard to get blood flow across, and it actually can be life-threatening. By dilating the vessels of the lung, pulmonary blood vessels, sildenafil can dramatically improve the ability for people who have this condition to exercise and improve their quality of life. But there's research benefits beyond that. In people with chronic heart failure, sildenafil has been shown to improve lung function and even prevent exercise-induced fluid buildup in the lungs. Now, because these drugs help blood vessels relax, they essentially improve the lining of the blood vessels, or the functioning of those blood vessels, called endothelial function. They may even help protect heart muscle itself from thickening and scarring over time. In fact, in a large US study looking at over 72,000 men with erectile dysfunction, found that men who were prescribed PDE5 inhibitors had a 13% lower rate of major adverse cardiovascular events. That's heart attacks, strokes, and death related to cardiovascular events, compared to men who weren't taking them. That's a big number. And there was a dose-response relationship, meaning the more consistently men use these medications, the greater the benefit appeared to be. Now, the highest users saw up to a 55% lower rate of these heart events. But before I say everyone should be taking them, these are observational studies. They are not randomized controlled trials, so we can't say for certain that the pills themselves are causing the benefit. It's possible that guys who are taking these pills are healthier in other ways, but the signal is consistent, it's strong, and it's showing up across multiple studies. There's also research showing benefits in heart failure. In patients with heart failure with reduced ejection fraction, which is a very specific type of heart failure, basically the heart isn't pumping strongly enough, and they also have secondary pulmonary hypertension, they've shown improvements in exercise capacity and hemodynamics, meaning your heart rate and blood pressure. Also, in another study, a meta-analysis of 24 randomized controlled trials found that when people took PDE5 inhibitors for prolonged periods of time, they had reduced left ventricular mass, meaning that they saw a reversal in some of the thickening of the heart muscle, improved ejection fraction, meaning it's pushing out more blood, and lowered heart failure markers called NT-proBNP. Now, it's not all rosy, right? There is one major cardiovascular risk you need to know about. You never want to take these pills if you are taking nitrates. Nitrates are medications like nitroglycerin that are commonly prescribed for chest pain. You put it underneath your tongue if you have chest pain to help. When you take that and a PDE5 inhibitor, you can have your blood pressure drop very, very low, potentially fatally low. And so after taking any of these pills, sildenafil, vardenafil, you ideally want to wait 24 hours before taking a nitrate. But you can't control when you get chest pain, right? So that's what we say, generally you don't want to take them together. And guys, this is not just theoretical. There was a Swedish registry study that showed that men who used PDE5 inhibitors and nitrates together had a 39% higher risk of death and a 72% higher risk of heart attack. But when you avoid nitrates or you're not taking them, there's really no increase in cardiovascular events. So it is very, very safe. Now, there are guidelines, they're called the Princeton Consensus Guidelines, that you can use to determine if you need any further heart workup before you start PDE5 inhibitors. Next up, the neurological or brain benefits. PDE5 inhibitors might actually benefit the brain and the nervous system. Now, how these work is that PDE5 is expressed in specific brain regions, including the hippocampus, the cerebellum, and the substantia nigra. Both sildenafil and tadalafil cross the blood-brain barrier, meaning they will get into the brain. And a meta-analysis of 34 preclinical studies, so these are not clinical studies, they're preclinical, showed that PDE5 inhibitors reduced neuroinflammation, oxidative stress, and even decreased amyloid burden, which is what builds up in people who have Alzheimer's disease, in only animal models. In human trials, they did a systematic review and meta-analysis of 6 studies that encompassed over 8.3 million people, and they found that PDE5 inhibitor use was associated with a 47% lower risk of Alzheimer's disease. Now, this is an association, not causation, meaning PDE5 inhibitors did not prevent Alzheimer's, but there was a correlation. And the studies were actually variable in terms of quality, and there's been no randomized controlled trials yet that showed PDE5 inhibitors prevent or treat Alzheimer's disease. But it is very interesting. There's also research looking at stroke recovery, specifically whether PDE5 inhibitors can promote the growth of new blood vessels and nerve cells in the brain after stroke. This is called angiogenesis or neurogenesis, and it's a very difficult thing to induce in the body. In preclinical publications that looked at over 3,600 animals, they found that PDE5 inhibitors had neuroprotective and neurorestorative effects. So they reduce the death of neurons, they decrease neuroinflammation, they increase new blood vessel formation, and improved blood flow to the ischemic penumbra, which is the at-risk tissue surrounding the stroke, and they improve functional recovery. But it was most effective when it was given within 24 hours after the stroke. Now, this is really exciting, but most of this data on stroke and TBI is in animal models. We really need well-designed human trials before we can start doling this out as a treatment after stroke or as having any prevention in terms of Alzheimer's disease. But again, this makes sense. The brain is very vascular, and cGMP plays a real important role in signaling of the nerves and essentially improving blood flow to the brain or the cerebrum. Next up is muscle health. So just like anywhere else in the body, if you have more cGMP, you have more smooth muscle relaxation and you have more blood flow. And when you have more blood flow to skeletal muscle, that can have some really interesting downstream effects. Now, these are small studies, but in one study in 43 non-obese men who had mild ED, they found that daily tadalafil 5 milligrams for 2 months showed increased abdominal lean mass as measured by a DEXA scan. But if you stop the medication after 2 months, that effect went away. The same study found improvements in endothelial function that correlated with insulin levels. And in the lab, they've seen that tadalafil has been seen to increase androgen receptor expression and myogenin, which is a protein that's involved in muscle development in skeletal muscle cells. We're not at the point of prescribing Viagra or Cialis as a muscle-building drug, and there are obviously lots of claims online saying it doubles skeletal muscle protein synthesis. That is not true, but there is some data, but it's not well established yet. And most of the data comes from small studies, cell culture experiments, or animal research. So we don't know the long-term effects of this or the optimal dosing for muscle health. And we really don't know because at higher doses, they may actually have negative impacts on muscle. So I don't want you guys to just start taking it, unless you need it for other reasons. Now, as a urologist, there are other urologic applications that are FDA approved for medications, specifically Tadalafil. Tadalafil, or Cialis, is FDA approved for BPH, or benign prostatic hyperplasia. Now, that's the condition I've talked about a lot on this channel. Basically, your prostate is enlarged and it leads to symptoms like urinary frequency, urgency, a weak stream, difficulty emptying your bladder, waking up at night. And so Tadalafil also relaxes the smooth muscles of the prostate, the bladder neck, and the urethra. So it essentially helps symptoms of BPH as well. So when you take Tadalafil, you have relaxation and you can pee better. And it works. There's actually been several large randomized control trials showing it's efficacious. And so if you have BPH and you have problems with erections, it's a great convenient single medication you can take that you can do for both, and I prescribe it all the time. Now, there's also some research with Tadalafil and Sildenafil for chronic prostatitis and chronic pelvic pain syndrome. There was a Cochrane systematic review that looked at multiple studies of PDE5 inhibitors, again, mostly Tadalafil because it has a longer half-life and lasts for about 3 days in the system. And they found that it might reduce prostatitis and pelvic pain symptoms. But again, small studies. So really exciting stuff, right? But I do want to give you a caveat. This is all still in the research phase. It's very, very promising, especially for the brain and the heart and even muscle health, but a lot of it is still in animal models or very small preclinical trials or clinical trials. We really need larger, well-designed human studies before we can start saying, yes, this does this, this does that, because sometimes you can find at different doses, it has opposite or negative effects. And like any medication, PDE5 inhibitors do have side effects, commonly things like headaches, flushing, nasal congestion, even indigestion. And sometimes it can even cause a significant drop in blood pressure. And as I said, you cannot take them if you're taking nitrates because of that reason. But as you guys know, I've said it many, many times before, I think these medications are wonderful for erectile function. If they have other benefits, that's just great. If you guys found this interesting, make sure you subscribe to the channel for more evidence-based content on urologic and sexual health. And as always, remember to take care of yourself because you are worth it.